Hip labral repair with 2.4 mm mini-hip push-lock anchors. The anterolateral portal is established by inserting a spinal needle through the capsule and removing the inner stylet. The nitinol wire is then placed through the needle and the needle is removed from the joint. Next, a metal cannula is introduced over a cannulated obturator and an arthroscope is inserted through the cannula and into the joint. The mid-anterior portal is then established in a similar manner. A capsule cut blade is inserted through the mid-anterior portal to create an interportal capsulotomy between the anterolateral portal. A graduated switching stick is inserted into the joint and the soft tissue distance is measured for a Trimmick custom hip cannula. The flexible cannula is then cut to the measured length and loaded into the adjustable obturator for insertion. A retractable hood burr is used to complete an acetabuloplasty and prepare the rim for anchor placement. The sheath of the burr can be exposed to protect the capsular and labral tissue or retracted to give better visibility. The round portion of a suture tape is loaded into the top jaw of the hip labral scorpion suture passer, and the back of the handle of the scorpion is squeezed to load the suture into the notch of the needle. The scorpion is used to pass the suture tape around the labrum in a single step. The suture is disengaged from the scorpion and the two suture tails are loaded through the PushLock anchor eyelet. The suture tails are clamped with a hemostat and a drill guide is placed along the acetabulum to create a pilot hole for anchor insertion. The drill guide is removed and the PushLock anchor is brought into the joint with the sutures under tension. The driver is advanced into the bone socket and the suture limbs are released. The orange cap is impacted with a mallet to bury the eyelet to the bottom of the bone socket and additional tension is pulled if needed. The orange cap is removed once the barbed portion of the implant is flush with the bone and the barbed anchor is impacted until the laser line is buried in the bone socket. The inserter handle is removed and an open-ended suture cutter is used to cut the sutures flush with the bone socket, and additional implants are inserted as needed.